interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
It's important to take this medication before you eat, about 30 minutes. So you want to take it in the morning, about 30 minutes before breakfast. Don't shoot or crush the pills. And she is probably not breastfeeding, but if she was, we would not want her to take it. And it's also important to monitor for any diarrhea, especially diarrhea with fever, because this medication can, because it changes the acidic content in the stomach, it can allow bacteria to grow and then we can get C. diff, and that's no fun.
What are the side effects and potential adverse reactions?
Omeprazole is generally well tolerated for most people. Most of the side effects are going to be GI related, so abdominal pain, diarrhea, some nausea, and it can cause a headache as well.
How will you know the medication is effective?
Her pain won't be as bad. Do you have any questions for me before we go in and administer the patient their medication?
No, thank you so much for answering my questions.
Not a problem at all. It is important to know your patient and the medication you are administering. So we are going to go in and pull the medication before we go in there. So we go into the orders for our provider. And you can see here that he ordered the omeprazole, 20 milligrams daily. So we'll go into our MAR. Here. Into our MAR. And we have omeprazole, 20 milligrams by mouth daily, and it is due at 9 o'clock. So we're going to pull our medication here. It's this one. Dun, 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 dun. Okay, so we're going to check our medication, and it's omeprazole, 20 milligrams. The medication isn't expired, it doesn't look weird. 20 milligrams, and it's a tablet, so we can give it by mouth. All right, excellent. All right, we'll go ahead and go into the patient's room. Knock, knock, knock. Hey, hello there. My name is Allison. I'm going to be your nurse today, and this is Robin. She's a level 1 nursing student. She's just following me for the day. Okay, so we are going to give you your medication here. Can you tell me your name and your birthday?
I'm Georgia Pie, and I'm 61.
Excellent. Thank you so much. Oh, you know what? It would be a great idea if I actually clicked on this button here.
Yeah, it would.
So let's go ahead and click on the button, and then we'll verify your identity again.
I'm
Name and
Georgia
birthday.
Pie. I'm 61.
Thank you so much, Miss Pie. How are you doing today?
Pretty good.
All right. We are going to be giving you your omeprazole, and that is for the pain that you're feeling, like kind of right here in your chest and your abdomen.
All right.
And that does treat the acidity in your stomach, so it reduces the stomach acid. And I'm going to look at the medication again, and I'm just going to verify that it's the right dose, the right med, the right time, the right patient, and the right route, which is by mouth. Do you have any allergies, Miss Pie?
I do, to sulfa.
Excellent. This does not contain any sulfa, so you are good to go.
That's good.
All right, do you have water?
I do.
All right, have you ordered your breakfast tray yet?
I got an omelet.
You ate already?
No, I'm gonna get an omelet.
All right, good. Because this medication, it absorbs best on an empty stomach, so you want to take it about 30 minutes before you eat, okay?
All right.
So your tray's on the way?
Yep.
All right, so there's that. Down the hatch. Excellent. Thank you so much. All right. Now I know that you had a history of the GERD, the gastroesophageal reflux. I know you had a history of that, correct?
Correct.
And you were treated for that?
Yes.
And then it kind of came back, didn't it?
I think so.
Okay. We think so too. So
Okay.
you do have a couple of cardiac tests that are scheduled, and we're just doing that just to rule out any cardiac issues, so bear with us while we do all those. But a couple of things about GERD. You're going to try to avoid spicy food.
Okay.
And anything that's really acidic, because you want to reduce the acidity in your stomach. And also, it's really important not to lay down right after you eat dinner, and I'm guilty of that. So what you want to do is kind of try to stay upright after you eat dinner.
Okay.
Okay, I know it's hard because you
Yeah.
eat and then you just want to go to sleep. But try to stay up for
Okay.
about 30 minutes. And then about the medication, it's really important that you take it according to the doctor's order. So when you get your prescription, when you go home, take it according to the doctor's order. Don't stop taking it because you feel better, because this isn't a cure. It's a short-term therapy, and then you feel better. So just make sure you
Okay.
take it according to the order. And also make sure that you report any diarrhea, any black or tardy stools to us, any change in your stools, especially if you feel ill. And make sure you take this 30 minutes before meals, okay, when you go home.
Okay.
Sound good?
It does.
All right, I'm going to go ahead and document that I gave you this medication here.
Okay.
And my initials. In the future, excellent. What time is it right now? Let's try this. What time is it?
Go with 8:50. Yeah. They're like 8:05.
8:43. Ah, there we go. The medication has been administered.
That's fantastic.
All right. Do you have any additional questions for me, Miss Pye?
Nope. I'm good.
Alrighty. Excellent. Well, we will be back to check on you shortly, okay?
Sounds good.
Let me know how that omelet is.
I hope it's
I heard
good.
they're good around here.
Better not be cold.
I hope not. You let me know if it is. We'll warm it up for you.
Alright.
Alrighty. Okay.
Thank you so much for demonstrating a safe medication administration. I just have a couple more questions, if you don't mind.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client the med?
Well, I reviewed what kind of tests and things that we were going to do for her so that I could let her know when I walked in there. And, you know, just went through her chart. I made sure that she wasn't taking Plavix, because again, you want to be really careful if they're taking a blood thinner, especially Plavix. And I don't think she's breastfeeding. So, yeah.
All right, and did this information affect your decision to administer the med?
I chose to administer it because all signs pointed to it was okay to do so.
All right, and did this information affect how you administered the med?
Nope, it's a PO med, so we gave it that way.
All right, thank you so much for answering all my questions. I really feel like I understand this so much better.
Oh, good. I'm going to take some time and document some the teaching that I provided to her. Would you like to observe me document?
Oh, of course, I would love to.
Excellent.